Hi, everyone. Thank you for coming today. This is the Women's Leadership and Resource Center, and you're here for the Feminism's Lunch Lecture Series. Feminism means different things to different people, so which is why we have this series. It's kind of a chance to explore what feminism looks like to different people within different locations, different contexts, and also to explore things through the lens of feminism. Today we've got Megan Daniel here with us. Megan is a PhD student in the Department of Sociology here at UIC. Her research centers on social movements and feminist theories with a particular focus on intersectionality and reproduction. And she'll be talking about the Chicago Abortion Fund and margins to center organizing. Everyone, please give Megan a big hand.
Thanks, Athanasia, for the presentation coordination and for the Women's Leadership and Resource Center for hosting this lecture series and for having me here as a part of it. And thanks everyone for being here. I'm thrilled to share this space with you all and talk to you about some of my favorite things, feminisms and reproductive justice. And a special thank you to the people in the room that shared their time and energy to this project, whether it was through mentorship or sitting down with me for an interview. I'm so grateful to you all for sharing with me your words and your wisdom. The title of this talk is From Transactional to Transformational, Reproductive Justice and Margins to Center Organizing. I want to leave plenty of time for all of your questions and suggestions at the end, so with that, we'll jump right in. Activists for reproductive freedom have complicated the ways that scholars think about social movements by organizing along non-traditional trajectories. The reproductive rights movement, largely a legal one, focuses on protecting the right to choose abortion. The reproductive justice movement, on the other hand, critiques this liberalist vision of choice and urges organizers to consider intersectional and overlapping oppressions. Bringing intersectionality theory to bear on canonical social movement literature is critical, and it changes the way that we conceive of radicalism and possibilities for social change. Intersectionality is both a theoretical approach and an organizing strategy with substantial effects on social movement organizations and their outcomes. Margins to Center organizing, from bell hooks' feminist theory, builds upon intersectional and Black feminist epistemological scholarship and is one such strategy that's yet to be centered in social movement scholarship. This organizing strategy incorporates people, quote, on the margins to participate in the movement as makers of theory and leaders of action. So we'll be discussing these important concepts today and their relevance for feminisms and reproductive justice, and we'll do that through lifting up the work of an amazing organization right here in this city, the Chicago Abortion Fund. I was first introduced to CAF through my mentor and an advisor on this project, Dr. Sakile Nzinga Johnson, who is now the Senior Director of Programs at the Health and Medicine Policy Research Group. CAF's vision statement is freedom, justice, autonomy, and this is what they believe the world will look like when their collective work is complete. Their mission statement states the organization, quote, promotes reproductive justice by funding abortions, advocating for reproductive autonomy, and organizing for racial, gender, and economic justice. We support the people most impacted by social, economic, and political barriers so they can become strong reproductive justice advocates in their own communities and beyond. CAF has embraced and enacted a reproductive justice framework and institutionalized platforms for engaging community members as advocates and leaders. However, at its founding in 1985, CAF looked a little bit different than it does today. So my research examines why and how an organization with roots in white, choice-based reproductive rights activism has transformed so enormously over the past 30 years. And to understand why these differences matter for reproductive freedom and for feminisms, we need to discuss reproductive justice and reproductive rights. The term reproductive justice was coined in 1994 by the African American Women's Caucus at the Illinois Pro-Choice Alliance Conference right here in Chicago. This caucus was formed shortly after members returned from delegating at the 1994 International Conference on Population and Development in Cairo, Egypt. They sought to broaden the organizing scope beyond a focus of the legal right to choose abortion and incorporate a human rights language to address the entire person. So physical, mental, spiritual, political, social, environmental, and economic well-being of women and girls came to the center of consideration. And focusing on justice and incorporating a human rights approach, activists deliberately avoided the word choice because, as Dorothy Roberts articulated 3 years later in her foundational work, Killing the Black Body, quote, "The abstract freedom to choose is of meager value without meaningful options from which to choose and the ability to effectuate one's choice." Proponents of reproductive justice, emerging from women of color organizing, demanded change on community, institutional, and societal levels, in addition to the individual level, to end all forms of oppression, including forces that deprive us of self-determination and control over our bodies, and limit our reproductive choices. Reproductive justice connected the work that women of color activists had been doing for decades, organizing in various communities for reproductive freedom, and brought historical organizing narratives to bear on present inequalities. And for a more complete history of this autonomous women of color organizing, it's important to read the book Undivided Rights, for which we have a co-author in the room today. It's more expansive than the history I'm able to offer you all. So since this historic moment in 1994, activists and scholars have utilized the language of reproductive justice to create a corresponding three-pronged framework for their organizing and activism. Reproductive justice thus encompasses the right to have children, the right to not have children, and the right to parent with dignity in safe and healthy environments. This is more expansive than reproductive rights. Scholars have argued that focusing on abortion rights and the legal right to choose, quote, "obscures the social context in which individuals make choices and discounts the ways in which the state regulates populations, disciplines individual bodies, and exercises control over sexuality, gender, and reproduction," end quote. Political, economic, and social tensions between these two movements have been documented by scholars, activists, and mainstream media, and expose the continued rifts in feminist movements. This is particularly visible and particularly problematic when primarily white and middle-class reproductive rights activists adopt and appropriate the language of reproductive justice, which was developed by African American women. So maintaining the distinction between these two movements and documenting the powerful and instructive histories of reproductive justice activists is important in opposing the whitewashing of social movement histories. So this study examines Chicago Abortion Fund, or CAF's, embodiments of these macro-level social movement tensions and its surprising and instructive transformation from a reproductive rights platform to a reproductive justice one. This analysis challenges clear-cut notions of social movement organizational development and creates space for the introduction of new organizational tactics and ideologies altogether. Many organizations that focus on reproductive health care and specifically abortion institutionalize this pro-choice discourse and become progressively less radical over time. As Andrea Smith argues, this rights-based pro-choice framework masks the capitalist and white supremacist structures which underlie and shape reproductive choices that people, particularly people of color and indigenous people, make. This vision, the reproductive rights one, incorporates liberalism's notions of freedom and equality, assuming that all people are free to make choices and have an equal repertoire of choices at their disposal. These organizations tend towards a myopic focus on the right to choose. So again, I'm asking, why and how did an organization emerging from this feminist history manage to radicalize and move towards a reproductive justice framework? So what began as a case study into the contemporary politics and workings of CAF became a project about the organization's transformation over time. It became a more historical project. CAF is widely known as the Women of Color-led Abortion Fund, doing reproductive justice work, and this runs counter to the logic of de-radicalization often seen in mainstream feminist organizations. So to examine such transformations within CAF and document this important history, I utilized participant observation, archival research, and in-depth interview data collection methods informed by the tenets of community-engaged scholarship. I entered the field as a student and social movement supporter in January of 2015, initiated archival research in the summer of 2015, and the special collections are available here at the UIC library. I encourage you to check them out either for CAF or any other organization that interests you. And then in order to gain a more in-depth understanding of the historical arcs that I saw in the archives, I conducted interviews with feminists involved in organizing around reproduction during the mid-1980s. These in-depth interviews supplemented ones with activists, executive directors, and board members in CAF and reproductive justice movements since 1985, and spoke to activists' experience of social movement organizing around reproduction. The sample thus consists of key informants in the 1980s, founders, former and current executive directors, former and current board members, former employees, recent fellows, interns, and community member volunteers. And as I said, Chicago Abortion Fund represents an interesting microcosm of these social movement tensions. Many of the organizations that started or were involved with CAF at its founding have either dissipated or institutionalized the choice-based rhetoric of reproductive rights. CAF has formally adopted and implemented a radical framework. Social movement scholars have documented the tension between organizations and movements, and you can see by the sizing of the text which type of literature I'm going to prioritize for this talk today. So some argue that organizations promote mobilization, and others argue that organizations in fact de-radicalize and kill movements. Others discuss cycles of protest in which some periods are marked by heightened activity, others by doldrums or relative inactivity. And while temporality and historicity are crucial to understanding organizational trajectories, so are mechanisms of framing and reframing. Further still, and most importantly, intersectionality provides a framework through which to introduce constructions of gender, race, class, sexuality, ability, and nationality to social movement literature, and center the ways in which these overlapping identities and forms of oppression are synergistic rather than merely additive, and that's from Kimberly Crenshaw. Coalitional intersectionality has been addressed as a social movement strategy in sociology and in gender and women's studies scholarship, but sociological applications of intersectionality to single organizational trajectories are rare. So this analysis seeks to fill that gap in the sociological literature and contribute to growing scholarship on reproductive justice. So how has CAF been able to issue clean-cut predictions of institutionalization and radicalization while embracing and enacting a radical reproductive justice approach? CAF's development into a women of color-led organization doing reproductive justice work, has been driven by the demands of activists, organizers, and community members, and these demands were brought to bear on organizational growth at specific conjunctures that are important. They've shaped successive stages of growth, which I label including, leading, and engaging. I argue that there are several reasons that CAF followed this trajectory. First, CAF's founders positioned themselves to the left of what they considered mainstream feminist organizing. So one may say that the organization was primed for such a transformation, although by no means should we take this for granted. We see a lot of organizing today done by white feminists who consider themselves to be particularly radical or leftist, and this organizing doesn't end up in any sort of radical place like CAF has. Second, utilizing the energy of decades of explosive, autonomous organizing, women of color activists within this organization and others in the Chicago area filled CAF's leadership positions with women of color community activists who brought community connections and a focus on economic and racial justice to the table. Third, in accordance with the work of Black feminist scholar Patricia Hill Collins, the organization adopted a Black feminist epistemological approach to organizing. This epistemological approach was adopted in tandem with a transition in racial leadership in 1994 when CAF hired its first African American executive director, Tony Von Leonard. This epistemological approach reached its logical extension in creating platforms for engaging community members to be leaders and advocates in their own neighborhoods and communities, echoing bell hooks' feminist theory and literally bringing them from margins to center of social movement organizing. This margins to center organizing allowed for the centering of structural conjunctures of intersecting oppressions in reproductive justice activism. This margins to center organizing also shifted the seats of knowledge to the organizational base and constituency. It necessitated the considerations and incorporations of issues beyond just reproduction to incorporate economic and racial structures into the mix. Chicago has a rich and storied history of activism and organizing around reproduction. Less than 20 years prior to the conception of Chicago Abortion Fund, before Roe v. Wade ruled the right to safe and legal abortion constitutional, white feminists here in Chicago founded an underground abortion collective called Jane. What began as a referral service to doctors willing to perform the then illegal outpatient procedure turned into service provision in which advocates took knowledge into their own hands and performed the safe abortions themselves. As correctly predicted by these activists and by women of color advocating for reproductive freedom in the decades prior to Roe, backlash followed swiftly and effectively on the heels of the Supreme Court decision. Illinois Representative Henry Hyde said, "I would certainly like to prevent, if I could legally, anybody having an abortion, a rich woman, a middle-class woman, or a poor woman. Unfortunately, the only vehicle available is the Medicaid bill." By 1976, Congress passed the Hyde Amendment, which is still in effect today. It banned federal funding of recently legalized abortion services. So Hyde eliminated funding for Medicaid, Medicare, Children's Health Insurance Program enrollees, federal employees and their dependents, Peace Corps volunteers, Native Americans enrolled in Indian Health Services, women in federal prisons and detention centers, and low-income women in the District of Columbia. The amendment most adversely and immediately impacted Medicaid enrollees, a disproportionate amount of whom were women of color. It is in this political climate that advocates from Health Evaluation and Referral Services, Women Organized for Reproductive Choice, NARAL Illinois, Chicago Women's Health Center, and Illinois Pro-Choice Alliance came together to, quote, provide financial aid to poor women in Chicago who need abortions. One founder recalls this moment in our interview, noting that there was a partnership of several women's reproductive rights groups. They decided to send out a letter to mailing lists we had, saying we'd really like to start a fund to help women have abortions. And they thought they'd get a couple $100, and they got a couple thousand. That was the founding moment. CAF, by its very mission and purpose, went beyond gender in considerations of reproductive freedom by considering economic justice and class privilege. The organization destabilized the concept of choice because founders acknowledged that economic oppression removed the ability to freely choose abortion. The work of funding abortions for low-income people who cannot afford them goes beyond single-issue activism around gender by considering class. However, people of color were notably absent from the organization, despite acknowledgement in board meetings and outreach letters that women of color were disproportionately impacted by cuts to federal funding and that the organization should, quote, seek their input. CAF was very much a white women's movement, as one founder recalls. She went on to note, we at least wanted to be working in solidarity with women of color. We were very conscious that we were not including them for the most part in our organization. And in fact, the minutes from the 1986 Board of Directors retreat said the following: it's difficult to take a white group and turn it into something else. CAF should have this minority input while it is still in the planning processes and decisions are still being made about its structure. This inclusion rhetoric did not go unscathed, and although class was crucial to CAF's early work, members needed to go beyond this moment to consider how the oppression and regulation of women of color's bodies, and black women's bodies specifically, were legacies that impacted their activism. From CAF's founding in 1985 until 1994, there was a mismatch in the leadership and constituency of the organization. In 1984, CAF recruited Mary Morton, an African-American Chicago activist, to the position of board chair. Morton had worked with the National Organization for Women chapter in Illinois and was active on the board of the Illinois Pro-Choice Alliance, of which CAF was a member. Morton quickly realized that CAF was operating within a reproductive rights framework, and she criticized the inclusion framework in the Pro-Choice Alliance. She argued inclusivity by its very name presents a problem. Race is fundamental to the work. And in our interview of CAF, she recalled, diversity is not just something that you can take out and dust off every other month at board meetings. It's a practice. It's central to organizing. Morton's organizing principles and work are reflective of Zakiya Luna's analysis of reproductive justice as framework, theory, and practice. Her work also highlights the beginning of the process to radicalize CAF and adopt a Black feminist epistemological approach to organizing. In 1994, under Mary Morton's leadership, CAF hired their first African-American executive director, Tony Bond Leonard. Leonard came to CAF with a background in community organizing and medical advocacy with rape victims advocates, and is now widely known for her work as executive director of Black Women for Reproductive Justice and her work with the National Network of Abortion Funds, Sister Song Women of Color Reproductive Justice Collective, and Trust Black Women. Prior to Tony Bond Leonard's hire, CAF was without an executive director for some time, as the board was committed to filling a position with the women of color. This is different than prior acts of expediency we see in other white women's organizations, which, professing to women's empowerment, sideline women of color and their concerns in favor of getting the job done. CAF didn't just change organizational frameworks or slogans or pay lip service to diversity or inclusion, but instead integrated a shifting frame into the organization, starting with leadership. The work also began to change as CAF took a more intersectional approach to organizing. This shift was supported by wider movement milestones, especially the 1994 convening of the African American Women's Caucus at the IPCA conference in Chicago, because of course it was here that African American women, Tony Bond Leonard included, coined the term reproductive justice. Leonard and Morton recruited other women of color to board and staff positions, including Nitris Johnson, who then was client service coordinator and later was executive director. It's during Tony Bond Leonard's leadership that CAF members began to engage in community organizing, such as condom distribution, holistic reproductive health seminars, in addition to just funding abortions. Such strategies marked the beginning of bringing women of color from the margins to the center of organizing. Johnson also came to CAF with community organizing experience with rape victims advocates, and together with Tony Bond Leonard began discussing safe sex and contraception with young people in the neighborhoods CAF served and with their clients. By incorporating community members' needs and ideas into their work, they were utilizing an intersectional approach to outreach. Rather than maintaining divisions between service providers and receivers, divisions which are often made based on hierarchical valuations of professionalization and education, CAF was beginning to break down problematic notions of expertise and knowledge. CAF leaders began shifting the sites of knowledge and power that inform their organizing, which is reflective of both margins to center and intersectional feminist praxis. Such praxis built on knowledge, skills, and community connections that CAF leaders brought to the organization. For example, Nitris Johnson, self-situating as a member of the community, extended beyond neighborhood residents and reflects a sense of connection and personal accountability to the work. Johnson had been funding abortions long before her work with CAF and remembers pawning jewelry, delaying bills, and doing, quote, whatever she had to help other women pay for abortions, insisting, I knew if I needed it, they would do it for me. She also recalls telling a coworker, it's not these women, we are the women we fund. You are these women, I am these women. At any given moment, we could be on the other line. This lived experience is a criterion of meaning in line with Patricia Hill Collins' Black feminist thought, and it's during this time in CAF's history that Black women began calling upon lived experience as knowledge validation process. Previous inclusion models argued for women of color's representation on the basis that the majority of the clients were women of color, a stance that I argue can be tokenizing and definitely overlooks the autonomous women of color organizing that had been going on for decades. It also misses the power of bringing people from margins to center of organizing as leaders and as stakeholders. It's also during this leading stage that Tony Bond Leonard and Wynette Willis, another African American woman who filled Mary Morton's position as board chair, and other movement builders started African American Women Evolving, later became Black Women for Reproductive Justice. This was to create space for and address the unique needs and experiences of Black women. First, a project of CAF, AAWE marked the first organizing approach specifically created to focus on Black women's reproductive health concerns. AAWE members engaged in self-help and consciousness-raising sessions with community members and clients, and such an initiative highlights the intersectional approach to organizing I mentioned earlier and illuminates the importance of frame integration and reproductive justice praxis. As the authors of Undivided Rights document, the racial hierarchies of CAF were still a barrier to engaging women of color in the movement. Wynette Willis and Tony Bond Leonard still saw CAF, quote, as an organization of white women that provided services to women of color. Most of the board members were white, and the majority of the donors and supporters were white middle to upper class women and men. They felt that some of the white women on the board were paternalistic in their approach to CAF's clients, end quote. Again, CAF does not follow a linear trajectory of radicalization, and although there were women of color in leadership at the time, it's not necessarily becoming progressively radical as each year goes by, but has some shifts along the way. The work of Mary Morton, Tony Bond Leonard, Nitris Johnson, and Wynette Willis was monumental in shifting the course of the organization's history, but some white board members still felt the organization should stick to only funding abortions. AAWE separated formally from CAF in 1999, and Leonard transitioned to work there as their executive director full-time in 2001. Johnson became CAF's executive director, and it remained until 2005 when Galen Alcaraz was hired by the board of directors, again under Mary Morton's leadership. These leaders, and now executive director Brittany Miller Keith, continue to incorporate reproductive justice framing into the mission, vision, and praxis of the organization. They built upon the important community engagement and Black feminist epistemological approach of this leading stage to more fully integrate reproductive justice praxis into the organization. By changing who was at the helm of the organization and working to change the organization's structure and mission, CAF members were eventually able to change what the organization did on the ground. Thus, leading was a mechanism for integrating frame shifts into all levels of the organization and for creating new projects, such as grassroots community organizing and later a leadership group that eventually became part of the organizational structure. Because of this valuable work and the 1994 coining of reproductive justice, organizational tides were turning towards this justice approach in framing and praxis of CAF. While CAF's leading stage members incorporated lived experience and standpoint theory, leaders from 2005 onwards formalized this Black feminist epistemological approach by creating what Patricia Hill Collins calls a safe space and engaging community members as leaders for reproductive justice by bringing them from margins to center. This specific approach centered the experience and knowledge of CAF's clients and constituents and thus changed the structure and future goals of the organization. Gaylon Alcaraz came to CAF in 2005 with a background in community and grassroots organizing and continued the work of bringing more women of color into the fold. She recalls, quote, "Over the years, I've been very intentional about looking, searching, connecting, and networking with women of color for board opportunities. Veronica, a woman of color who accepted such a board position, recalled Gaylon as a hurricane of energy who discussed intersectional activism and reproductive justice as framework for CAF. Alcaraz sought to create safe space in other ways, one of which was through the 2007 creation of the My Voice, My Choice Leadership Group, which engaged former clients to become leaders in their communities. Her background impacted her leadership vision. She reflects, because I'm a community organizer, I was always thinking in the back of my head, where are the women that are impacted by this? Why aren't they involved with us? They should be at the table. Their voices should be heard. Historically, abortion funds, they give out money and then that's it. There's no follow-up, there's nothing after. I wanted to call the women back that we were funding to find out what was going on with them. Reproductive justice is not just about abortion. It's about everything in a woman's life, her entire life. Through the leadership group, activists sought to remedy top-down leadership approaches often seen in white liberal feminist organizations and instead operate from the bottom up. As such, Alcaraz secured funding for the leadership group, which engaged interested former clients by asking what their needs were and what they were interested in learning about. In addition to covering housing justice, job searches, and professionalization trainings, leadership group members advocated for reproductive freedom in their neighborhoods. They produced and starred in television episodes addressing abortion access and reproductive justice freedom, canvassed neighborhoods to get signatures on abortion access bills, went to local and national conferences on reproductive health and justice, and worked on strategic planning committees at CAF. Thus, Alcaraz and CAF's supportive donors and board members sought to connect with the organization's constituents through a formalized organizational platform. During Alcaraz's tenure, the board voted to adopt a reproductive justice framework into CAF's mission and vision statements, written materials, and approaches to organizing. This shift formalized the grassroots organizing and leadership training CAF had been engaging with through safe sex education, legislative campaigns, and the leadership group. This also represented a successful alliance between some white elite women and women of color activists working for reproductive freedom, affirming the leftist positionality of some white members in the movement. However, some donors were unhappy with CAF's expanding scope. Former board member Jean Peterman recalls, there were some fairly wealthy people that don't give to us anymore because they didn't want their money to go to this other stuff. Select wealthy white funders were tied to the transactional approach to healthcare access, which did little to destabilize inequities or dismantle punitive legislation against poor women. This is not an isolated perspective, for social justice organizations, especially those run by and for women of color, experience tension with funding sources. However, CAF's executive director and staff were not beholden to the board and continued their work engaging community members. Such engagement brought mostly Black young women to a political and affirming space where they engaged with intersecting forms of oppression that impacted their daily lives, created lasting friendships, and reaffirmed positive self-evaluations. This is reflected in the, quote, creative tension linking how social conditions influence Black women's standpoint and how the power of their ideas gave many African American women the strength to shape those same social conditions, and that's from Collins. Leadership group members would have otherwise only interacted with CAF in the capacity of a transactional abortion funding experience. One member of the leadership group, who is now the executive director, Brittany Miller recalls of her time in the leadership group. We weren't out there to recruit folks or anything. We were just there for informational and educational purposes. We're out in the streets, going to the malls and shopping areas. We're out in the laundromats. We're in the communities. And I think that that's extremely important, because you can pass out papers all day long and stand on the corner asking for signatures all day long, but it's like they see you, they hear from you, and I tell them where I'm from. I do that because it makes it personal. During this engaging stage, the board also brought on interns and created an additional paid position for a reproductive justice fellow. While most abortion funds run on volunteers, CAF sought to pay staff for their jobs because this work, the labor that we're doing, that's part of reproductive justice. And that's coming from Cynthia Zepeda, who was the first reproductive justice fellow with CAF. Fellow and intern energy was pivotal in making CAF a transformational organization rather than a transactional one. They did outreach programs, passed out condoms, created pamphlets, encouraged community members to contact representatives, and reminded them that reproductive justice is the right to do what you want, but not just in terms of if you want to terminate a pregnancy. It's the right to have a family and make sure you have the means to do that. It's way more community-driven than just a pro-choice type of ideology, and that's from Olivia Dockery, who interned with CAF. Fellows facilitated workshops at local high schools through a program called Sisters Making a Change, where they discussed reproductive justice and did activities to build trust and get the conversation going. Incorporating youth into this work exemplifies another axis of intersectional organizing. By answering students' questions, taking their concerns seriously, and incorporating their perspectives, the RJ Fellows and interns were addressing education and age, in addition to economic, racial, and reproductive justice. Remembering this community outreach, Cynthia remembers, we're not only talking about reproductive rights, we're capturing all of these other isms, right? All of these other factors that impact a person's life. Cynthia ran CAF's hotline in addition to engaging community organizing and strived to connect clients with job opportunities. As current executive director Brittany Miller argues, she didn't have to do that, but that's what I mean by really moving to that transformational place. Just the act of someone helping you figure all of that out and navigating that can be transformational. Brittany Miller came up through the leadership group, worked as the deputy director of the organization, and transitioned to executive director in 2015. She continues this expansive work for reproductive justice, and invoking bell hooks to describe the importance of her organizing, she argues, thinking about reproductive justice, we have to be taking someone from the margins and meeting folks where they are, and I mean that literally and however else we can take it. Brittany's engagement is indicative of a Black feminist epistemological approach, which requires people to, quote, learn to center in another experience, validate it, and judge it by its own standards, end quote. Brittany reflects on her own entry into CAF, recalling that it came along at a time when I needed something more. When I called, I knew it was a woman of color on the other line, and I knew that it was different than state social service agencies. It was personal, they cared. That Brittany felt validated and engaged was why she had a transformational rather than just a transactional experience with CAF. It is also quite literally the means by which she was engaged from margins to center. Engaging former clients to be reproductive justice advocates aligns with the reproductive justice framework and also affirms CAF as a safe space. Capitalizing on prior validations of Black women's knowledge, the leadership group fostered Black feminist intellectuals who were personal advocates for their material, accountable for the consequences of their work, and had lived or experienced their material in some fashion. They were not only willing to engage in dialogues about their experiences with everyday people, but were passionate, critical, and agentic in doing so. These intellectuals have been centered in CAF and used their transformational leadership experiences to validate their own and each other's voices. This is fundamentally different to the ways in which other mainstream organizations operate with regards to the centrality or the sidelining of race in their work. In discussing the pitfalls of an inclusion approach, which activists argue is still prominent in mainstream organizing, Brittany asks, is this for tokenism? What are we doing here? Including is like, this is our stuff, let's bring them into it, and I see that a lot. Don't call me after the fact. Why wasn't I a part of this in the first place? And with regards to inviting one or two women of color, quote, to the table, Brittany notes, that's a lot for one person to be. They have to carry that, and it's up to them to represent the Black woman or something, and to hold folks accountable. I'm thankful that I'm not in that space. Organizers in other cities and at other abortion funds look to CAF as an example of how to move beyond such tactics in meaningful and intentional ways. Several note that the appointment of the first African American co-chair of the board of directors was pivotal in recruiting subsequent African American and Black women leaders to the organization, who together created shifts in organizational praxis. This work has continued and can be seen in the current leadership structure and printed materials of the organization. Brittany Miller Keith is a Black woman who is also a former client. CAF's board of directors recently elected 2 Black women to serve as board co-chairs for the first time in the organization's history. The board of directors recently voted 1 young Latina, 2 Black women, 1 older and 1 younger, and 1 white woman on as new board members. Sekile Nzinga Johnson, current board co-chair and board recruitment chair, was intentional about bringing women of color who were grounded in reproductive justice to the organization, and about strengthening the organization's work with Latina and Latinx activists here in Chicago. Now the 14-person board is comprised of 6 women of color and 7 white women. It is also diverse by age, socioeconomic status, and sexuality. The organization's printed materials and public messages about the clients they serve have incorporated language beyond the term women to include trans, queer, and non-binary people. This intentionality around language better characterizes the people that Chicago Abortion Fund serves and has been serving for the past 30 years, and represents a critical shift in the reproductive justice movement, as it's broadened its scope beyond the struggles of only cisgender women. I argue the engaging stage mobilized Black women activists as a social justice project organized around the dual goals of empowering African American women and fostering social justice. The interplay between lived experiences of clients who were relegated to the margins amidst intersecting forms of oppression and their activism is a testament to the capacity of reproductive justice organizing and activist agency to create social change. These organizational shifts exemplify what Bell Hooks calls the creation of a liberatory ideology, which she says is only possible, quote, if the experiences of people on the margin who suffer sexist oppression and other forms of group oppression are understood, addressed, and incorporated. They must participate in feminist movement as makers of theory and leaders of action, end quote. Black women created and forwarded the movement for reproductive justice. They have joined leadership positions and have been joined by other women of color. They are leaders of action is indisputable. CAP's growth from a transactional service agency to a transformational reproductive justice organization affirms that these reproductive justice activists are makers of theory as well. The lived experiences of their organizing and their powerful articulations of them hold immense potential for organizing against oppression and towards social justice. Social movement organizers and theorists in other fields would do well to follow their lead, because as Bell Hooks argues, we all need to make a conscious break with the system. I argue that the reproductive justice movement and praxis and the activists who transform CAF are that conscious break. Thank you. So we have some time for suggestions, questions, comments, and they've reminded me that if you would like to ask a question, to please step up to the microphone.
This one? Sure. Okay, so thank you, Megan. I'm Arden Handler. I'm a founding member of CAF and a professor here at in UIC School of Public Health. And I think that, Megan and I, we met once or twice during the course of this. I think one thing that I think is really important and that should be fixed, and I think is that the original members of CAF came out of 2 to 4 organizations, and that Women Organized for Reproductive Choice was not a pro-choice organization. It was a reproductive rights organization, and a pro-choice organization and a reproductive rights organization at that time were 2 different ththings. Mm-hmm. We thought of ourselves as very different from NARAL and Pro-Choice Alliance and what was the other one there's another pro-choice group.
Planned Parenthood.
Yeah, we barely communicated with those people because we felt like their analysis was extremely limited to one thing called abortion. And so I just want to give you a sense of who we were, a Chicago-based organization of women's rights activists who believe women have the right to control their own lives, crucial to that control is the right to have healthy children when and if we choose. We believe we must organize to ensure these rights. We support the right and access of all women to abortion. We oppose all forms of sterilization abuse, which was a big agenda item for Carassa in New York. We oppose all forms of racism. We demand access to effective, safe birth control. We support sex education. We support people's rights to determine his or her personal and sexual relations. We demand the right to have healthy children when we choose. We recognize that reproductive freedom cannot be achieved if women are forced to be undereducated, or underemployed, poor, sick, or victims of racism. Therefore, we demand equal opportunity and equal wages for all women, decent housing and health care, quality child care, a home free from violence, and a safe workplace. So that's 1980. That's not a pro-choice movement. I think it would be better, I don't know where you're at in your book, in your chapters, to go back and think about pro-choice, reproductive rights, and reproductive justice. All right, there are three different movements. The women in reproductive rights came out of a socialist feminist movement, some of whom were anarchist and communist feminists, and they were not liberal feminists. And I've been reading a lot about lately, reproductive justice articles, and conflating liberal feminism and pro-choice, I think, is correct, but conflating the reproductive rights movement that arose after Hyde was very much a left-wing. You said it at the end, and Pro-Choice Alliance was not a left-wing group. Planned Parenthood was not a left-wing group. We were a leftist group that came out of our own leftist organizing around other issues. And you could see here, this was 1980, what we're talking about. So I just think it's a little upsetting at this point to have it all mushed together. And I think eventually, because it became a service organization, it started to have more of a leadership. The leadership became more service-focused and more, I think, came out of the pro-choice group. So, and then it morphed appropriately. But I just want to get that history straight, because there was a very radical analysis going on by the women who were part of the creation of this, and certainly WRC. So I brought, this is our book that we wrote, New Right versus Women's Rights, Women Under Attack, Abortion Stare. I mean, we were writing this stuff all about, racism and, in 79, 78. So I just want to get that part straight.
Yeah, thank you, absolutely. And I think, too, that it's very important to get that straight, because the leftist positionality of some of the founders is probably what allowed CAF to transform appropriately to a reproductive justice framework over the past 30 years. So thank you.
I just have a quick question. What made you interested in this particular line of research, particularly since it sounds like it centers Black women's epistemologies?
That's a great question, thanks. So I came to graduate school in 2014 interested in social activism for reproductive freedom, and kind of understanding that there were tensions between these two movements. And when I first learned about CAF through mentor and advisor Sakile and Sika Johnson, she introduced me to how the organization employed a reproductive justice approach. And now there's other ways to do that too that don't only center on a Black feminist epistemology, but because reproductive justice was created here in Chicago by Black women, I felt that it was important that any project that I did, especially one that focused on CAF here in Chicago, centered that theoretical and epistemological approach. And that also comes from the people that I interviewed. I followed their leads in ascertaining which literature was important to reference, which literature they were in conversation with as makers of theory themselves. And so that's why I rely primarily on those bodies of work.
Really good job, Megan. I wanted to ask, so you talked a little bit about the funding shift sort of after this new reproductive justice framework sort of came into fruition. But I wanted to know if you could speak a little bit more about how, especially with the sort of constraints that a lot of nonprofits and community organizations face in having to sort of, play to whatever their funders want them to do, how the CAF is sort of able to sort of get the best of both worlds, I guess.
Yeah. So like I said, CAF did lose a couple of select wealthy funders in the suburbs that weren't too happy about their expanding scope. And I think, too, the big thing that comes from funding that we see is foundational funding and applications to grants. And so CAF was able to secure grants for the leadership group. Galen Alcaraz did that at the same time that they were losing money. So it kind of they made ends meet eventually by looking to other places for that funding.
So I too, Megan, thank you for all of your work on this. This is really impressive and exciting, journey to bear witness to. I wanted to add just a point of clarification around the significance of Galen's work when it came to hiring Brittany. I think it's important for you to document that piece too, in that when the board was informed that Galen was going to be transitioning out of her position, she was very explicit about saying that she saw Brittany as her successor and saw her as the person that should step into that space, and she advocated for that. And so what she also did was disrupt the traditional hiring process. Generally you put a call out and you ask for job applications and you go through a formal interview process. But I think it's really important to kind of think about the significance of advocating for what kind of person should be stepping into the role of the executive director to run CAF. That was an intentionality from the former director to kind of advocate for that process, and it was a cooperation from the board to recognize that as a significant point of departure, to really think about who should be leading this organization, and having faith and trust that Brittany was the person to be able to occupy that position and do this work well, and to support her in her current work. So I think that that's an important piece, that Galen was intentional about disrupting what the hiring process should look like, and I think that's for me a very progressive component of CAF's current work that I wanted to make sure we captured. And then the other piece that I thought was important was she also, as she was transitioning off of from her position, she wanted to make sure, she communicated quite clearly that she wanted women of color to be centered on the board, and so she left us with the charge to kind of keep women at the center on the board, and so that fueled the process of making sure that we continue to seek and engage folks in the community and keep us at the center. So I just wanted to kind of offer those two clarifying.
Thank you.
Are there any other questions? Yes.
So, terrific talk. I really
Coming up here. Thank you.
Thank you for the talk. I really appreciated your periodization. I'm a historian, so I really liked how you broke that up. So the question I had about that is, why was it just in 1995, or these nodes that you see switching periods, that something happened? Was it just bringing on a new hire? Was there something larger in society also pushing those changes forward around the periodization that you have, which I thought was really nice? I also really liked your alliteration from transactional to transformative. I thought that was lovely.
That's Brittany's. And Yamani Hernandez, who's the executive director of NANAF now.
So that's great. And so I have questions thinking through that, though. One, in and of itself, the original transactional approach, which is just directly paying for abortion, does that have some transformative power in and of itself? And I guess the question leading to that is, I think you want to show this evolution from transactional to transformation, but is the transactional still transformative in and of itself?
Okay, great. Thanks, Heather. Yeah, so it was not only shifts in racial leadership, especially in the mid-1990s, that brought CAF into this leading and then further engaging stage, but that was supported by wider movement milestones. So like the creation of reproductive justice here in Chicago in the mid-1990s. People started writing about and acknowledging more publicly in mainstream media the autonomous work that women of color had been doing for decades and decades. So it became less and less about bringing women of color into white liberal feminist organizations, and there was this fervor around reproductive justice organizing and claiming that. So, and then your second question was, is there transformational power in the transaction, right, in funding abortions? I think that there is. I think that what was really transformational comparatively, though, is when, under Galen's leadership, CAF folks started calling clients back to see how they were doing, sending follow-up care packages, and making sure that they had the capacity to do that. Making sure that they were treated with respect at their abortion procedures, and making sure that they had good working relationship with the clinics that they referred to. So I do think that there is something transformational about funding an abortion. And as I said, Nitris Johnson, who was the client services coordinator and then executive director, said that she'd been funding abortions long before she came to CAF because she knew that it would be something that someone would do for her had she needed it. So I do think that there is some sort of transformative potential in raising funds, in giving money out, and making sure people can access the health care that they need but might not be able to afford.
Any other questions?
Thanks, Megan. I wondered if you could talk a little bit about CAF's relationship to the sort of medicalization of abortion over time. And I think you mentioned in the beginning a little bit about the sort of history of DIY reproductive techniques and things like that feminists were engaged in from the 60s and 70s in particular, and how that shifted over time, and how CAF interacts with the sort of top-down hierarchical model of medicine that they have to sort of fund people to then walk right into, and if that's sort of theorized in the work at all.
Yeah, that's not something that I touch on this paper, but it is a really interesting dynamic because CAF has developed into this bottom-up organization, this groundswell organization that brings power and potential from community members into the work in the center, but then interacts with an establishment and an institution that's almost completely the opposite of that. I think that in part making sure that CAF's clients are treated with respect when they go to get an abortion procedure is one way that they interact with that system in a way that advocates on behalf of clients. Terminating relationships in the past with clinics that they didn't have good experiences with is another one, and not sending people there. But I don't go into it much deeper than that. Yeah.
I just had like a real basic question, but I was just wondering where it's located or what communities like do you choose to go into?
So CAF has a hotline that's open to people who need funding for abortion and makes decisions based on the capacity financially that they have. The majority of CAF's clients call from Austin and Inglewood, but they don't make funding decisions based on the residence of the potential client that's calling on the phone. So they do it based on need. They see if they'll fund a partial procedure and then see if that person can kind of get support from their family and their friends to cover the rest of the cost. And then CAF is located just here in Chicago. And they do work out in the community they recently co-sponsored an event about the Repealing Hyde Amendment with Lifted Voices and For the People's Artists Collective. So if you like them and follow them on Facebook, you'll get to see what's popping up next and go to some of their events downtown.
Okay, I was just wondering because like I know I heard in your talk that you did a lot of community outreach, but I'm like from the south side of Chicago and I feel like I've never heard of CAF before, so I'm just wondering like what more would they be able to do to like reach these neighborhoods that like are working class neighborhoods and predominantly like Latino or Black neighborhoods, because like I just find it strange. I've never heard of it, or like any of my friends either. Whenever we like discuss reproductive rights or anything, like it's mostly Planned Parenthood or like Chicago Women's Health Center, but like nothing. I've never heard of this before.
Yeah,
so.
And I mean, I think it's important that you highlight that because the reason why CAF has maintained relative autonomy over their framework and their organizing strategies is because they're small and scrappy, right? And when they were doing community outreach through the leadership group, there were at any given time 2 to 8 people out, and I'm not really sure which blocks they go to, right? But when you think about the person power of a smaller nonprofit like CAF versus the massive amount of funding that's behind advertising campaigns for organizations like Planned Parenthood, we can see why sometimes, I mean, it's hard, we can't canvass an entire city. So the Reproductive Justice Fellows and Interns did absolutely everything they could outreach-wise, but it's a massive city. And so because the organization is small, yeah.
And I'll expand on that. CAF So we use the term CAF, and it sounds bigger than it is, but we have one employee and the board and sometimes volunteers. So it's a very small organization, and it generally will have 1 to maybe 4, depending on funding, for that year. But 4 employees at CAF is huge. So you're generally, when we talk about CAF, it's the board and the executive director. So that probably helps clarify what you're asking.
And I guess it just brings up more like discussion because like learning of the history and how it's such like a leftist group and supportive of like women of color as opposed to like other organizations who have been like more pro-choice as she stated. It's just kind of like upsetting.
Small.
Yeah.
Mm-hmm. Yeah.
Anyone else? All right, everybody, give Megan a big hand.
Thank you.